Hi, I'm Katie,
And I'm Nawal.
and we will be talking about the medical drama's effect on public perception.
The topics we are covering today are the prevalence of medical dramas, their positive and negative effects on healthcare, and some methods for combating negative effects.
So first up, we have the prevalence of medical dramas. Medical dramas have been around since around the 1950s with the Drama City Hospital. Since then, they have essentially become their own genre with dozens of shows being made a year. One of the longest running medical dramas also happens to be the soap opera General Hospital. One of the most critically acclaimed dramas is ER, which I personally watched for the first time this semester. This show has won 156 awards and won the People's Choice Award for Favorite Television Dramatic Series for 8 times in a row.
So, why does this matter? Because of cultivation theory. Cultivation theory essentially explains that people make general assumptions on the world based on the world they see on TV. For example, watching Grey's Anatomy, one can assume that hospitals are filled with drama and everyone's hooking up with each other, or after watching ER, assuming that emergency rooms are extremely fast-paced. While these assumptions can hold some truths, they are generally very exaggerated.
So the cultivation theory most greatly affects populations with low health literacy. This can include those that are older or have lower income, receive limited education, and are non-native English speakers. In a study, they found that medical dramas are used as a primary source of medical information by non-health oriented people, those with below basic or basic health literacy, and are used more often as secondary source of information behind interpersonal communication for those that are uninsured, have lower socioeconomic status, and or have immigrated to America.
Next up, we have the positive effects of medical dramas on healthcare.
Medical dramas have been proving to improve medical knowledge of medical terminology, as we can see with this clip from The Good Doctor.
See the retrohepatic part of the cancer because of the liver. We can't see the retroperitoneal part because of the right kidney.
Yes, I know. That's why we should take out the organs.
You want to remove her liver and right kidney?
Yes, and also her left kidney and her pancreas and the intestinal tract and the stomach.
You do know that several of those organs are quite essential.
We'll put them back. We remove them, clean up the cancer, then put them back.
Ex vivo surgery.
It's been done for pancreatic cancer.
Without much success.
No. You think it worked better here?
Not really. But the alternative is death.
So from this clip, we can learn that ex vivo surgery is taking the organs out of one's body and then cleaning up what we need to clean up and putting it back in. And we can learn that from these sort of clips that I personally did not know before. These dramas also bring exposure to various medical conditions. This can include basic information like signs and symptoms and the impact on the patient and their loved ones. The first example that comes to mind for me is from Grey's Anatomy, where one of the main characters received cancer. In one episode, they revealed all of her symptoms and they were trying to solve exactly what she has. And then after she got that diagnosis, we got to see how it impacted her and everyone else on the show.
Medical dramas also show people moral and ethical dilemmas. Basically, every episode of pretty much every show includes at least one dilemma. What these dramas add to the cases is the drama. We get to see a whole narrative around these dilemmas that have hard-hitting emotional points, as well as complete context with the traumatic backstory of the provider, as well as the compelling story of the patient. Our first example is from Scrubs, where they are talking about insurance fraud.
So you're the one who told Kelso that Mr. Martinez was dead? That's terrific work.
Looks like word gets around.
What in the name of are you there, God? It's me, Margaret, were you thinking?
Well, I'm new here, but I'm relatively certain that invasive vascular procedures have a very low success rate on dead people.
That TIPS procedure was for Mrs. Blitt down in 103. You see, she doesn't have insurance. Mr. Martinez, on the other hand, had great insurance. Should I talk slower or go get a nurse who speaks fluent moron?
Here, Cox is trying to give a dead patient's insurance to a different patient without insurance that needs a surgery. While illegal, it brings up inaccessibility to healthcare and the ethics of it. Next is an example from Chicago Med, and it talks about treating a patient against the will of their guardian.
Take this down to the lab, quickly.
You got it.
Stop right there, Dr. Manning.
Lucas, you scoped him?
We told her not to.
Dr. Manning, I'm sorry, but you need to come with us.
Hold on, what are the charges?
Unlawful restraint, as well as medical assault and battery.
Please, Mr. and Mrs. Harper, Lucas has clots and inflammation in his lungs and airways. This is not a sinus infection. It is far more serious.
We want our son discharged now.
Let's go, Dr. Manning.
No, please, if you want to help your son, okay, just wait for the labs to come back. Do not take him out of the hospital, please.
I'll page Peter Kalmick and have him meet her at the station.
Absolutely not.
Excuse me?
The hospital's not going to protect her. She got herself into this mess. She can get herself out of it.
In this clip, we can see that Dr. Manning is trying to treat a patient against his parents' wishes. This brings up autonomy and paternalism in healthcare, which we will talk about later.
There's also typically a positive portrayal of healthcare professionals in these shows, which makes sense since they are the protagonists. Some positive traits that are commonly associated with healthcare professionals are qualified, competent, professional, brave, and intelligent. This influences viewers' perceptions of healthcare professionals, as Nawal talked about with the cultivation theory. And as seen with the study written by Dr. Ryan Quick, consumption of medical dramas can lead to increased patient satisfaction. These dramas can also serve as inspiration for the younger generation to enter the medical field. This can be seen through seeing the hustle and bustle of the hospital or wanting to be like the professionals that they grew up watching.
Now, taking a 180, we're going to talk about the negative effects medical dramas may potentially have on viewers and their perceptions of healthcare.
Medical dramas, as the name suggests, are all about the drama, meaning it pretty much over-exaggerates what happens in real life. For example, you can have elaborate love tropes or scandalous affairs, which are far from the monotonous day-to-day social life in the hospital. Another and arguably more precedent issue is medical dramas underrepresenting what happens in real life. Often the distribution of illness that takes place on medical dramas is not representative of what happens in real hospitals. In fact, one study found that CPR survival rate was 10 times higher in medical dramas than it was in real life.
Because of the tendency of medical shows to dramatize routine ailments and procedures for increased viewership, there's also an increased fear of them. Mortality rates in TV hospitals are 9 times higher than real life hospitals. So when a viewer is watching their go-to show and sees many patients dying, they fear the medical care in the system that they may seek in the future.
Continue with the theme of portrayal in hospital systems, healthcare providers are often shown as incentivized by money rather than caring for their patients. Here we have a clip from the medical drama New Amsterdam.
Will everyone in the cardiac surgical department please raise your hands? Great. Great. Thank you. You're all fired. Any department who places billing above care, you will be terminated. So, how can I help?
In this clip, Dr. Max, the new medical director, fires the entire cardiology department because they are only motivated by money and not by patient care and service. In reality, most providers care very much for their patients, working long, grueling hours, so having a portrayal of a mass exodus is showing the average viewer that your doctor does not care about you, but the money in your wallet. This can also be seen in shows like House MD.
Can't just randomly stab the temporal lobe and hope you hit the right spot.
I'm only gonna take little tiny pieces.
Till what?
Till I find the problem.
Or you kill him.
No, I'll keep going even if I kill him.
In shows like House, physicians are shown to be arrogant and unempathetic towards their patients with absolutely no repercussions. In reality, there is an ethics code healthcare providers have to follow, and it has no room for this sort of care portrayed by Dr. House.
A big issue in medical dramas is the lack of representation. This slide is just a visual of some casts of famous medical dramas. The majority of casts are white, and with leads usually being male and doctors. In the bottom right corner, we have an example of a new show called Nurses, which follows the main leads being nurses as opposed to doctors. Building on the last slide, medical dramas historically lack diversity. This includes racial, religious, sexual orientation and gender, and professional diversity. Newer shows like The Good Doctor attempt to provide a broader scope of diversity. The lead, Dr. Sean Murphy, has autism, and the show follows the challenges he faces to prove his value to the medical team. The show also has considerably more diversity compared to other shows like ER, whose earlier seasons are mainly white characters. Most medical shows lack diversity in regards to professional diversity. The focus tends to be on doctors or medical residents. Shows rarely show nurses, lab technicians, pharmacists, or physical therapists, all of which are important members of the healthcare team. There is a lack of representation of the growing interdisciplinary approach dominating healthcare at the moment.
Now that we have discussed the possible negative effects of medical dramas, we want to take a look at how to combat them.
From the creators of medical dramas, disclaimers and resources provided at the beginning of the episodes can provide an educational opportunity for viewers. During the pandemic, many medical shows did episodes on their respective fictional universes depicting the pandemic. These shows added disclaimers to educate viewers and provide them with accurate and up-to-date information. On the side here, we have an example from Grey's Anatomy where they provide a website for accurate, up-to-date information on the COVID vaccine.
Medical organizations have also been increasing their presence on social media, making them more accessible to the younger generation. Organizations like the APHA, also known as the American Pharmacists Association, have been using their online presence to promote patient education. On the right, we have an example of the APHA providing information in an easily digestible format on the COVID-19 vaccine to prepare patients for their shots.
On social media platforms like YouTube, healthcare providers are dispelling misinformation. On the right, we have an example from Dr. Mike.
Clear.
He just literally put one of the paddles on the top of her chest and the other one would look like on her abdomen to shock her. It's not the way you do it. You have to do it on the chest.
In this clip, we see Dr. Mike reacting to an episode of ER. He corrects and explains the correct placement of a defibrillator.
Day-in-the-life videos on platforms like TikTok provide an accurate representation of the role of healthcare providers. On the right, we have an example of a day of life in a pharmacist. These sort of short videos that are easily accessible to viewers provide a glimpse into the plethora of healthcare fields, as well as the role of healthcare providers that are not well represented in medical dramas.
Because viewers, as we mentioned previously, may have hesitations when approaching their own providers because of how providers are portrayed in medical dramas, open communication from the provider is necessary to make the patient feel comfortable. Ways to make sure communication is open and effective is asking open-ended questions, speaking in simple language, and assuring the patient that communication is confidential.
There are four models of care. In the paternalistic model that we mentioned earlier, providers decide for the patient. In the formative model, providers give the patient the facts. In the interpretive model, providers help the patient find their preference. And in the final model, the deliberative model, the provider helps the patient find their preference and shares their own preference. Typically in medical dramas, a paternalistic or informative approach is taken, which is not preferable nor representative of real life. The final model is the most ideal. It allows collaboration between providers and patient to provide the best possible care.
And now, after discussing the positives and the negatives of medical dramas, it's time for the conclusions.
Medical dramas have a negative effect of perception and knowledge of healthcare 11% of the time, a positive effect 32% of the time, and a mixed effect 58% of the time.
From these numbers, we can conclude that there is a mixed effect on perception and knowledge of healthcare. We have to be conscious and critical of the media we consume. So that means taking the time to research and reach out to providers when there are questions. And finally, communication between patient and provider is key to provide the best care for each individual patient.
Thank you for viewing our presentation. We hope you have a great day.